Tissue expansion prior to augmentation of resorbed edentulous ridges with Osmed Hydrogel Expander Dental, in cooperation with PD Dr. Anton Friedmann and Dr. Dogan Karner of Charité Universitätsmedizin Berlin, Dental, Oral and Maxillary Medicine, Operative Dentistry and Periodontology. Why tissue expansion? Here is a case of an augmentation with a bone block without previous tissue expansion. Despite a good wound closure, at extensive augmentations, expositions are possible due to a deficit of soft tissue. Now you can see a case of an augmentation with a bone block with previous tissue expansion. The picture shows that sufficient soft tissue is available, and that the wound closure is possible without mobilization. The use of Osmed tissue expanders prior to the vertical augmentation of resorbed edentulous ridges reduces the mean incidence of post-operative graft exposition from 25 to 4%, and increases mean vertical bone gain from approximately 4 to 7.5 mm compared to augmentations without prior tissue expansion. Surgical technique, step by step. Resorbed edentulous ridge. Vertical and lateral augmentation is necessary prior to placement of implant. The templates are used for the selection of the appropriate expander type. The expander's final volume has to fit the designated surgical area. Incision and preparation of a tunnel flap. The preparation is controlled with a surgical template. Insertion of the expander and fixation with a bone fixation screw at the flap of the expander. Two-layered wound closure. The first suture enables a wound closure without tension. Usually tissue expansion and maturation are completed after 6 to 8 weeks. The expander is removed in the course of augmentation surgery. Incision and flap design are chosen as required for the intended method of bone augmentation. It is possible to cut directly into the expander. Implantation of tissue expander.
We plan to perform soft tissue expansion using an Osmed tissue expander before ridge reconstruction. We see a severely resorbed edentulous ridge with approximately 6 mm deficit or in the vertical dimension, and of course a corresponding lateral defect. We plan to place dental implants, and as you can see by the defect configuration, it is necessary to perform lateral and vertical ridge augmentation before placement of dental implants. Before the ridge augmentation, using an autogenous bone block from the mandibular ramus, we plan to implant an Osmed tissue expander in order to expand the alveolar mucosa, because we want to facilitate the primary closure of the flap. The appropriate size of the expander is selected using a surgical template. This side of the template corresponds to the final volume of the expander. This is the final volume of a 1.3 milliliter expander, and as you can see, the final volume might be too big because the expander might come into the ascending part of the mandibula. So we will try a smaller expander, for example, 0.7 milliliters. And this expander may be appropriate. This side of the template corresponds to the initial volume of the tissue expander. And with this side of the template, we plan the incision and the placement of the expander into the pouch. We start with a vertical incision in the mucosa. And we do not cut the periosteum. We stay in the connective tissue. We make a little bend to the distal aspect for better access. And then we begin to split the connective tissue. And still we do not cut the periosteum. Then we start with a blunt dissection of the pouch using the scissors. Finally, we check the preparation using the surgical template. Now we have a fine and elastic pouch above the periosteum. And as soon as the template fits into the pouch, our preparation is finished. The expander is fixed with a bone fixation screw, and that's why we perforate the expander's strap here. And a bone fixation screw is put into the hole. And then the expander is transferred to the pouch. Now the expander is placed into the pouch and we fix the bone fixation screw. The expander is placed and fits loosely into the pocket. And now we start a two-layered suturing. We start with a deep mattress suture for approximation of both flaps. Now we have placed the mattress sutures for taking tension of the flaps, and the remaining incision now is closed with simple single interrupted sutures. This is the end of the procedure. We have a tight two-layered suturing, and the expansion of the expander starts now, and after 4 to 6 weeks of expansion we will do our block graft surgery.
Explantation and bone augmentation.
Well, today we will perform second stage surgery in this our patient who underwent the first stage surgery 4 weeks ago. So inside, intraorally, we see now the situation with the expander inside within the soft tissues, demonstrating us the extension already occurred here in this area in the mandible posterior right side, where we will have to apply an autogenous bone block transplantation from the posterior side to the anterior, where the teeth are missing from number 5 on. Okay? So we see the situation of the extended mucosa in this area, and underneath there is the expander there, which will be extracted parallel to the soft tissue flap reflection and the preparation of the side. Okay, our first incision goes in the middle of the crest, mid-crestally, within the keratinized tissues. So we will stay a little bit aside from the position of our expander in this soft tissue. Okay, so we put the mid-crestal incision within the keratinized tissues, and now the sulcular incision around the anterior tooth, adjacent to the dentulous area, And in the front of this next tooth I will put the lesion incision. So the incision is performed, and now we will reflect the flap, opening up the side, and also we will find our expander in place. Sorry. Thanks. So here my screwdriver comes along, and you see now the screw is removed. Oops, okay. And now I will remove this expander out of the pouch. It sticks there, quite sticky. And here we go. And you see this expander is completely safe, so it is expanded in an optimal way, and still the outer silicone shield is around the capsule, so the function of this expander was ideal. Now we go ahead and preparing the flap. So here we have the defect extension in the area of former molars in this region here, and we will obtain the autogenous bone block in the posterior region somewhere here along this line, transplanting this bone graft to the more anterior area in this region behind this bicuspid, the first bicuspid on this side. And we will use piezo surgery for releasing this bone block in this area. Now we fixed the bone block with 3 fixation screws. It is absolutely stable, and it is really very precisely in space. Although we will add some bio-os material, some deproteinized bovine bone mineral. So here we go. Now we apply the cross-linked collagen material. That's how it looks like after the membrane is in place. It doesn't need any additional fixation. It will be fixed by the flap. So now we see soft tissue closure is completely achieved without any tangent to the soft tissues. So I have to take care of the membrane here. And we suture now with, first of all, Gore-Tex sutures as horizontal mattress suture, and then additionally combined with single stitches. Easy. Nicht mehr. Okay, so now we achieved complete soft tissue closure all over the space, a full flap adaptation, and there is no any tension in the flap tissues, as you can see here by touching the flap from both sides. It's really easy and without any tension on both sides, either in the posterior or in the anterior part of this surgical area. Well, thank you very much. That's it.
What is most important? Selection of appropriate size of the expander via template. Sufficient size of tunnel flap. Check with template. The template, respectively the expander, have to fit completely into the pocket. Screw not too tighten for not stressing the flap of the expander. Do not damage silicone shell. Two-layered wound closure. The first suture enables a wound closure without tension. The Osmed tissue expander cylinder dental is used for straight edentulous areas. The Osmed tissue expander cupula dental is used for small gaps or curved edentulous areas.